Hey everyone, Abdelrahmen Ali here. Welcome to our GCOS 2026 preview series. Over the next few weeks, we will be chatting with the speakers shaping this year's program in VCU. And to kick things off, I'm joined by someone who really needs no introduction in the cardio-oncology world. It's my pleasure today to introduce Dr. Teresa López Fernández. She's a senior consultant cardiologist at La Paz University Hospital in Madrid, where she heads the cardio-oncology program. She's internationally recognized for her expertise in cardiac imaging and cardiac cystic prevention, and she co-chaired the first European Society of Cardiology guidelines in cardio-oncology. She is currently the president of the ESC Council of Cardio-Oncology, an associate editor of the European Heart Journal, and leads the Spanish Cardio-Oncology Registry. It's a pleasure to have you here today, Dr. López.
Thank you very much.
My first question for you, you're co-chairing a session that brings together perspectives from Europe, Brazil, Australia, Africa. Why is this kind of global conversation so important right now?
Yeah, this is a very good question. Thank you. So as you know, cardio-oncology is getting complex. So we need to deal with, let's say, conventional cardiovascular problems, but also with new cardiovascular toxicities. And this is not the only point. We also need to deal with patients with cardiovascular diseases who develop cancer, and we need to organize the resources to make these cardio-oncology programs available and, more important, sustainable. So I think that we all face the same challenges, but sometimes we don't have the same solutions because of technical or personal restrictions, or because of limitation to access to educational programs in cardio-oncology, for many, many reasons. So to put together all the challenges and to try to work on uniform solutions that facilitate cancer treatment and help our patients is definitely the aim of this type of sessions. So to understand how we can collaborate in cardio-oncology network to advance the field and to advance the care of our patients.
Sounds good. Thank you so much for your answer. And I guess moving to the next question, without giving your whole talk away, what's one thing about the European experience in cardio-oncology that you think the rest of the world can learn from?
Well, in Europe, I think that we have quite a lot of experience in some countries in cardio-oncology. But when we think in Europe as global, we need to deal with many different health systems and countries with different level of resources and expertise. So from the ESC Council of Cardio-Oncology, what we are trying is to collect all these experiences in cardio-oncology and to try to offer global but also national solutions to advance the field. So one of the most important projects that we are currently working on is to ask our European national cardiac societies how can we help, what they need, how can we support the advance of cardio-oncology, because probably what we need in Spain is not exactly the same that people need in UK or Germany or Italy or Greece, because the health systems are not necessarily the same, and the access to different resources are definitely not uniform across Europe.
Okay, this is very thoughtful. So for early career cardiologists thinking about cardio-oncology as a path, what would you advise them?
Well, cardio-oncology needs to be more embedded in the core curriculum for general cardiologists. And I think that this is something that we need to work on, because this is not the reality nowadays in all the institutions. So cardio-oncology offers a really interesting perspective of cardiovascular medicine from the clinical point of view, from the research point of view, and is is definitely another way to work, because we cannot work as we used to do many years ago, like in silos. So we need to open the door of our clinics and to establish this collaboration with oncologists, with hematologists, with radiation oncologists, with all the professionals that take care of the patient during the cancer process. So this is also a really interesting way to have a continuous learning on how we can take care of our patients and improve their outcomes.
Sounds good. Thank you so much for giving us some of your time today. Looking forward to your lecture in GCOS 2026.
Looking forward to see you all in GCOS.
Thank you everyone for listening. Stay tuned for more interviews.